Hi, welcome to my comprehensive overview and for fibromyalgia and its treatment. My name is Jessica O'Leary and I'm a registered nurse currently attending ECPI University for my FNP. I'm currently in NUR 606, which covers pharmacology, and I will be going over how pharmacology relates to fibromyalgia and its pathophysiology and its treatments. Um, I'm going to go over, pharmacology, non-pharmacologic, and holistic approaches, as well as side effects and contraindications of medications, evidence-based treatment plans, and patient education strategies. The video recording for this presentation will be listed on a URL on the main slide. So, fibromyalgia overview. Fibromyalgia is a chronic pain disorder characterized by widespread musculoskeletal pain, fatigue, and cognitive disturbances. It affects approximately 2 to 4% of the population, with women being disproportionately affected. Fibromyalgia is not life-threatening, but it can significantly impair quality of life. Early recognition and management are essential to improving patient outcomes, as untreated fibromyalgia can lead to worsening symptoms and increase disability. Pathophysiology. Although the exact cause of fibromyalgia remains unclear, research suggests it involves abnormalities in central pain processing, often referred to as central sensitization. Sorry. This means that the nervous system amplifies pain signals. There are also imbalances in neurotransmitters such as serotonin, norepinephrine, and dopamine, which involve in a mood and pain perception. Dysregulation of the hypothalamic pituitary adrenal axis and autonomic nervous system may also contribute. Fibromyalgia is often seen alongside other conditions like irritable bowel syndrome, chronic fatigue syndrome, and depression, which further supports its neurobiological basis. Diagnostic criteria. Diagnosis of fibromyalgia is primarily clinical, as there is no definitive laboratory test. According to the 2016 American College of Rheumatology criteria, diagnosis involves assessing the widespread pain index, which identifies areas of pain, and using the symptom severity scale, which measures fatigue, sleep problems, and cognitive symptoms. Symptoms must be present for at least 3 to 5 months, and no other condition should explain the pain. Key symptoms include diffuse muscle pain, extreme fatigue, and what patients often describe as fibrofog or cognitive difficulties. 3 medications are FDA approved for fibromyalgia: duloxetine, milnacipran, and pregabalin. Duloxetine and milnacipran are serotonin norepinephrine reuptake inhibitors, or SNRIs, that help modulate pain pathways and improve mood. Pregabalin is an anticonvulsant that reduces nerve signal overactivity, helping to alleviate pain and improve sleep. Other medications, such as low-dose amitriptyline and cyclobenzaprine, are sometimes used especially to address sleep disturbance. Opioids and NSAIDs are generally not recommended because they provide little benefit for the central pain mechanism involved in fibromyalgia. Pharmacologic considerations. Each of these medications carries potential side effects and safety concerns. For example, duloxetine and milnacipran can cause nausea, dry mouth, and increased blood pressure. Pregabalin often leads to weight gain, edema, and dizziness. Tricyclic antidepressants like amitriptyline have anticholinergic effects, such as dry mouth and sedation, which can be problematic in elderly patients. Contraindications include uncontrolled hypertension for SNRIs and cardiac conduction issues for tricyclics. It is also important to monitor for serotonin syndrome when taking SNRIs that are combined with other serotogenetic agents. I'm sorry, I have a little bit of a stutter, and sometimes it's hard for me to say things. Non-pharmacologic management. Non-pharmacologic approaches are essential and often more effective when combined with medications. Low-impact aerobic exercises such as walking, swimming, or even Tai Chi has been shown to reduce pain and improve function. Cognitive behavioral therapy, or CBT, helps patients manage the emotional impact of chronic pain and reduce stress, which can trigger symptom flare-ups. Sleep and hygiene practices, such as maintaining a consistent sleep schedule and avoiding stimulants, are also critical as poor sleep can exacerbate fibromyalgia symptoms. Holistic and integrative approaches. Holistic and integrative approaches can complement traditional treatments. Mindfulness-based stress reduction and meditation have been demonstrated benefits for pain and emotional well-being. Yoga and Tai Chi combine gentle movement with mindfulness, improving both physical and psychological symptoms. Acupuncture and massage therapy can offer short-term relief of muscle pain and stiffness. Some patients also report benefits from an anti-inflammatory diet or supplements such as magnesium and vitamin D, even though evidence for supplements is still emerging. Evidence-based guidelines. Evidence-based guidelines from the American College of Rheumatology and European League Against Rheumatism recommend a multimodal approach that combines pharmacologic therapy, exercise, and CBT. Systematic review confirmed that aerobic exercise and behavioral therapies consistently improve pain, function, and mood. The American Pain Society also emphasizes shared decision-making and individualized plans of care, as treatment response varies widely among patients. Recent research continues to support early holistic intervention to improve long-term outcomes. And I just want to add that I used to work at a pediatric facility, hospital in San Diego, where we did CBT for pediatric patients that were kind of in a clinical trial. It was more on a research-based level. And those children that were coming in with fibromyalgia or other pain disorders, especially like referred pain disorder due to loss of limb, had fabulous outcomes. And the way that they work and, eventually figure out what's kind of making them have this like referred pain or this pain disorder was really quite interesting to see. And it was really nice to see those, amazing outcomes for these children who were having chronic pain for kind of hard to figure out reasons. Patient education. Patient education is critical in management, fibromyalgia management. Patients should understand that while there is no cure, symptoms can be managed with lifestyle changes and proper treatment. Regular exercise, and even in small amounts, is beneficial, as is maintaining good sleep hygiene and stress reduction. Behavioral strategies such as pacing activities and relaxation techniques can help reduce symptom flare-ups. Cultural and socioeconomic factors should also be considered. Some patients may have limited access to therapy or medications, so cost-effective options and community resources should definitely be discussed. Encouraging patients to track symptoms and triggers can also help with self-management. In summary, fibromyalgia is a chronic pain syndrome that requires comprehensive, multidisciplinary approach. Understanding its neurological underpinnings helps guide treatment, which should include both pharmacologic and non-pharmacologic strategies. Patient education and empowerment are essential for improving quality of life. Ongoing research into pathophysiology of fibromyalgia will continue to shape future treatments and enhance our ability to provide individualized care. Just a quick review of some of the literature that I used in this presentation today. I used the American College of Rheumatology. This publication from the ACR outlines the updated criteria used to diagnose fibromyalgia, moving away from the older tender point model instead and focusing on a combination of the widespread pain index and symptom severity score. These revisions provide a standardized evidence-based tool that supports clinical diagnosis, especially in primary care. It's key ruling out other diagnoses and improving accuracy in fibromyalgia detection. From Arnold et al. This article provides a practical framework for managing fibromyalgia in primary care. It emphasizes the importance of biopsychosocial approach, combining pharmacologic treatments with exercise, education, and behavioral strategies. It also highlights the need for individualized care plans and patient-provider collaboration to improve adherence and outcomes. From Forte et al. In summary, this systematic review evaluates the effectiveness of treatments across different subgroups of adults with fibromyalgia, including those with coexisting conditions or varying severity levels. It provides insight into which interventions work best for specific populations and stresses the importance of tailoring treatment plans based on individual patient profiles. From McFarlane et al., these are these are the European League Against Rheumatism updated guidelines for fibromyalgia management. They recommend non-pharmacological interventions, particularly exercise, as first-line treatment with pharmacologic options used as adjuncts. This reinforces the need for multimodal, evidence-based treatment and also highlights newer therapies being studied in Europe. From the National Institute of Arthritis and Musculoskeletal Skin Diseases, you can find a comprehensive overview of fibromyalgia, including symptoms, diagnosis, treatment, and current research. It's an excellent patient-facing resource that also considers patient diversity, the role of genetics, and environmental triggers. It supports the importance of education and empowering patients to manage their condition long term. Here is my complete reference list. I want to thank you for coming and enjoying my presentation on fibromyalgia. It was very important to me and kind of had a place close to my heart as one of my best friends has fibromyalgia and has struggled with it for a majority of her life. And one of the biggest complaints was that she had difficulty in getting a diagnosis. They originally thought that she had lupus. Um, but I will say that she engages in all the non-pharmacologic activity in order to try to manage her own symptoms. And she's a very active, healthy, person and is fit and exercises. And she has seen great relief in her pain over the years without any opioid medications. I mean, and of course, that is the non-recommended route for patient treatment. If there are any questions at all, if anyone, has something they want to ask me, I will be available to you in the comments or you can send me a direct message. And again, thank you so much for coming to my presentation. Bye, guys.